Thanks so much for joining me this morning. So, as I was saying at the top, clearly a good news report out of census. Lots of good news on the poverty rate now reaching actually pre-recession levels for the first time that we've seen that. Incomes up, health insurance coverage now at record highs. So 2016 was another good news year all around on the heels of 2015. What's driving this progress?
Well, the tightening labor market, of course, plays an important role. The unemployment rate last year, 2016, was a little bit below 5%. We were creating, about 180,000 jobs per month. That's a good clip. And in fact, one of the things that we saw pretty clearly in the data is that more people went to work, went into the labor market, and many people shifted from more part-time to full-time work, and that would increase their annual income, boosting both middle-class incomes and lowering poverty. This is an important theme that you and I have discussed, and I know it's one that looms large for you. And this is the idea that, if people have access to gainful, remunerative employment opportunities, I'm talking about low-income people, they will take advantage of them. And so too often the poverty debate, especially from the conservative side, focuses exclusively on people themselves as if they don't have a job because they don't want a job. More often than not, especially if we're talking about able-bodied working-age people, they very much want and need employment, but it's the demand side of the equation, the availability of good jobs that's left out. So that improved a bit in 2016.
So what role do we think that state and local minimum wage increases that we've seen over the past couple of years, which we know drove a lot of the progress in the 2015 historic gains on poverty and on income that we saw census report last year, what do we think that state and local minimum wage increases had to do with the gains that we've continued to see into 2016?
Well, these data only came out earlier this week, and we're still parsing some of those kinds of questions, but we have seen consistently that states which raise their minimum wage above the federal level stuck at $7.25, of course, and has been there for many years now, those states tend to show greater wage increases for low-wage workers. That's kind of intuitive. And since they don't really have much of a negative impact on employment availability, they tend to boost people's income as well. So you've got people working more employment, more hours typically at higher wages. And so I suspect that when we crunch the numbers, we'll find that poverty reductions have been significant in places that raised their minimum wages.
Now, obviously, when it comes to health insurance, it's hard to have a conversation about progress when it comes to health insurance rates now reaching record highs without mentioning the Affordable Care Act, which Republicans are not quite done trying to repeal. We'll be talking about that later in the show with Andy Slavitt. But I'd love to hear you talk a little bit about what you view as kind of the flip side of the story from census. We've got all of this good news, but it isn't because of decisions that we're seeing under the Trump administration or from even really the Republicans in Congress. It's all good news left over from the Obama years, isn't it?
Oh, no question. I mean, remember, these data are for 2016, so we were blissfully unaware of a Trump presidency back then for most of those months. And so, the Affordable Care Act, I mean, its fingerprints are unquestionably on one particular variable that we look at every year in this report, and that is the share of Americans who are uninsured. That share was about 15% before the ACA went into effect. As of this report, last year it was below 9%, 8.8%. That's the lowest level on record. So you can say what you want about the ACA, and I myself have some criticisms, some ways we could get under the hood and improve the performance of the Affordable Care Act. But one thing everybody has to acknowledge, if they're dealing in facts, which of course not everybody is that it has been instrumental in lowering the share of Americans without coverage to the lowest level on record.
So one of the things that I personally have been expecting to happen, given that it wouldn't be the first time we'd seen it from this president, is for Donald Trump, despite what you just said about the fact that all of these gains, all of this good news is actually due to policy decisions that predate his being sworn in as president, I'm still kind of expecting him to try to take credit for this good news report. I haven't seen him do it yet. I don't know if you've seen that. happen. But in fact, what I believe that these data end up actually showing us, and I'll say, let's not get the balloons out just yet or pop any corks, because what I view these data as telling us is actually not just that we know what works when it comes to cutting poverty, boosting incomes, making sure people have health insurance, but actually that all of those gains are incredibly precarious because of the political climate that we're in and the decisions that if Trump gets his way and if Republicans in Congress get their way with, for example, their budgets, we're actually going to see a lot of these gains erased. Some analysis just came out of the Center for American Progress, where I work in my day job, as it were, finding that if just three of the cuts that Donald Trump proposed in his budget released earlier this year had become law, cuts to nutrition assistance, cuts to energy assistance, and actually the rollback of Medicaid expansion and what that would mean for rising out-of-pocket health insurance costs, 2.3 million more Americans would have been poor in 2015, the latest year for which data are available. So really a stark fine point to put on what's at stake here. What are you viewing as what the American people need to be seeing when they think about what's at stake here and how it plays in with the ongoing budget fight that I'd like to talk to you more about throughout this hour?
Well, I stipulate to everything you just said, and in fact, my main theme when I was writing up the results from these data that we've been discussing was there's some momentum in the underlying economy, and there are a set of ideas out there that could really push back the wrong way against this momentum. So there are kind of a couple of dynamics worth getting into here. One, I mentioned in my answer to your first question. You asked sort of what are the economic underpinnings of these good results, and I talked about the solid labor market. But I think, and I've noted in your comments today that you're conscious of this as well, I think it's actually possible to overinterpret how positive these results are. They're definitely moving things in the right direction, but I like to take things in a longer historical context. And if you actually look, you yourself made this point, the poverty rate is back to where it was in 2007. Okay, well, in 2007, these are 2016 data, so that would be nine years before. The economy's grown a lot over those 9 years, and you might ask, well, why are poverty rates just back to where they were? Why aren't they lower? Let's not be a victim of diminished expectations here. Yes, median household income grew sharply over the last 2 years. I was very glad to see that. It took it back to about the same level it was at 2007, and that's about the same level it was in the year 2000. So, you're talking about a decade and a half where people in the middle class have been kind of struggling to get ahead. So let's not conflate a couple of good years with some sort of reversal of a set of structural underlying problems in the U.S. economy that continues to channel growth, even in these data, by the way, pretty aggressively to the top of the income scale. And regarding your policy points, the last thing you'd want to do is to kind of screw up the momentum we have right now with policies that reverse some of the very factors that are helping to generate these outcomes. So you mentioned cutting Medicaid. So cutting the heck out of Medicaid, repealing the Affordable Care Act. I mean, my last comment, I told you about the progress we've made against uninsurance with the ACA, and we know for a fact that as per the CBO scores on this, that the Republican plans would have absolutely made that worse.